Our Special Lives, and today we're going to talk about what happens when a feeding tube is placed and what to expect for the first couple of weeks after that surgery from a parent's perspective. Placing that feeding tube is done a couple of different ways, so I'll talk about our particular experience. At the hospital, our son was given some light sedation, and a pediatric surgeon performed a procedure which was quick, about 30 minutes. I'm simplifying some of the details, but the doctor used a scope down my son's mouth to look inside his stomach, and then made a small incision in his stomach and inserted the feeding tube after measuring to make sure that the right size tube was placed. Our surgeon at this stage inserted a real feeding tube. However, some surgeons insert a temporary tube or a malacot to be followed by a balloon or non-balloon feeding tube. Once the surgery was over, our son had a short stay in the hospital for a couple of days. Because a feeding tube incision is pretty small, we could use Tylenol for pain, but within a couple of days, he did not seem uncomfortable. There are a few important things to keep in mind during this initial period. One is to get a good refeeding plan from a pediatric gastroenterologist or nurse or registered dietitian before you go home. If you've ever had the stomach flu, then you know what a refeeding is. It's the process of slowly reintroducing liquids and food to the stomach. That process is going to start in the hospital, but the first week or so is going to require more careful feeding because the movement in the stomach is decreased after the surgery. For example, you might be told to start with small amounts of water or Pedialyte for 24 hours and then move on to small, more frequent amounts of formula, gradually increasing the volume over several days. Our son had an additional procedure called a Nissen fundoplication, or Nissen for short. This is where they wrap the top part of the stomach around the lower part of the esophagus in an effort to prevent reflux. If your child has had this additional procedure, it is extra important to follow a refeeding program because this procedure causes the stomach volume, or the amount of liquid or food that the stomach can hold, to decrease, sometimes significantly. And while a refeeding program is very important, it's not too complicated, and your healthcare practitioner should give you a program to follow. If they don't, though, you must ask. We were not sent home with a refeeding program, and our son ended up back in the hospital. Second, there are some post-operative wound care instructions for the small incision, some cleaning instructions such as washing gently with gentle soap and patting dry. Also, like with a newly pierced ear, the feeding tube needs to be rotated so the healing skin doesn't adhese or cling to the feeding tube. While you'll start doing this after the surgery, you'll need to continue to do this twice a day for as long as your child has the feeding tube. Luckily, we didn't have any complications, but some can occur, of course, and like with any surgery, you should know what to look for: bleeding, oozing, redness, or fever. Here's a short clip of what rotating the feeding tube looks like. Third, and I feel one of the most important things in all of this, is to make sure that the stoma site, or the hole that holds the feeding tube, heals well. And in order to do this, you have to make sure that the feeding tube is secured to the stomach with split gauze and tape so that the feeding tube itself doesn't continue to move too much and irritate that new skin until the stoma is completely healed. Here's what that looks like. First, you want to take the split gauze and wrap it around the feeding tube and secure the ends of the split gauze with tape. Next, you want to take tape and secure the bottom tab of the feeding tube to the stomach. And then take another piece of tape and secure the top tab to the stomach as well. A doctor or nurse in the GI practice can show you how to do this, and we actually did this for many months after my son's feeding tube was placed. If the tube site doesn't heal well, complications can develop. And again, it's not hard to do this, but just requires a small amount of effort, about 5 minutes twice a day after you rotate the feeding tube, as we discussed earlier. Fourth, you're going to need some medical supplies with a feeding tube. Someone in the GI doctor or pediatric surgeon's office is supposed to order these for you through a pediatric medical supply company. First, you want to make sure that this is done before you leave the hospital. Understand that you do have a choice which medical supply company you use, and some are better than others, so it will be helpful to speak with a nurse in the practice before the supplies are ordered. Our observation is that nurses are generally the best informed about which supply companies are going to provide the best service. You'll typically receive the standard amount of the supply that's allowable under your insurance. If you find that you need more of a particular supply, you should talk to your doctor and explain what is going on, and they can write a letter of medical necessity for the insurance company. This is a document which can override the typical allocation of a supply so that you can get a greater amount if you need it. So now I'll go through each of the supplies and show what they do. Split gauze and tape. We already saw how those are used to dress the feeding tube and the stoma when the stoma site is healing. Another thing we really like is this tape called Medipore, and this is a 5-inch tape. 3M makes it, and what I love about it is it rips off into 5-inch segments, if I can do that here. And what I love about this is you can stick this tape over the child's feeding tube to secure it. If the child is having tummy time or sleeping on their stomach or scooting or crawling on the ground, any time where there's the opportunity that that feeding tube might get pulled against the carpet or a surface, this really helps to secure the feeding tube to the stomach so it doesn't get pulled. Okay, now we'll talk about button buddies. Within a few months, maybe 6 months of the surgery, you can start using something called a button buddy instead of that split gauze and the tape. Button buddies are small circular pads that snap or Velcro around the feeding tube and keep the skin dry and cushioned around the feeding tube. Caregivers need to buy button buddies as they're not considered a medical supply, but there are several sellers on Etsy and Amazon, and I'll link to a couple below. Now we'll talk about gtube extensions. Gtube extensions are like straws that carry food from the feeding syringe down the tube and in through the feeding tube. There are 2 types of extensions. This one is called the Y port, and food goes in this, medication goes in this. And then this is called a bolus. And these are mostly used when families aren't giving lots of medication and giving sort of 3 distinct meals of formula or blended food. These feeding extensions go into the feeding tube and they snap in. You'll want to line up the lines on the extension and the feeding tube and swivel the extension so that the line on the feeding tube is away from the line on the feeding extension. And we'll show you this short video. If you don't do this, the extension will fall out. And if you're pushing food or medication, when the extension falls out, the food and medication will go everywhere. Then you'll receive syringes. The larger 35cc syringes are typically used for feeding and venting. I'll cover more about this in another video because that is a whole topic in itself. We have found that the best syringes for feeding in particular are the 60 ml Miracle O-ring syringes. The syringes themselves last a long time, and the tip is the least frustrating for getting a good seal on that feeding extension when you're going to feed. You'll receive some other syringes as well, a 10 ml, 3 ml, 6 ml, and these are great for giving medications. The feeding extension has a clip on it to prevent food from leaking back out of the stomach. The syringe is inserted into the port. The clip is undone. The liquid pushed through. The clip is redone and the syringe is removed. This was a big source of frustration for me when we first got the feeding tube, because if you do that sequence out of order, you'll have a big mess on your hands. I've developed somewhat of a mnemonic to make it easier to remember. SCPCS, syringe, clip, press, clip, syringe. That's the order that you need to do this in to be successful. Just repeat that a few times and you'll be glad you did. Now we're going to discuss the actual feeding tube. Whether you choose a balloon or non-balloon button, you'll need a backup balloon button at home so that a parent or caregiver can insert another feeding tube if the current feeding tube needs to be changed out or comes out for some reason. One more note about medical supplies, and I'll do a separate video on medical supplies, but you'll typically receive supplies on a monthly basis and they'll typically be sent to your home. You shouldn't rely completely on the medical supply company to deliver your supplies on time each month or completely. You must keep track of when your order is due and what you're supposed to get. And if there's a problem or you didn't get your supplies or didn't get all of a certain supply, you need to call the supply company right away. You don't want to get into a situation where you run out of medical supplies, and typically it takes several days to straighten out a missing or overdue supply order. Lastly, many children, particularly infants and toddlers, go home with a machine called a feeding pump and feeding bags that go with that feeding pump. Parents pour formula into a feeding bag and hook it up to the feeding pump. One end of the bag goes into the feeding extension, which is attached to the feeding tube, and the pump pushes formula into the feeding tube over a certain time at a certain rate. This machine and the bags are provided by the medical supply company. If your child is going to be using a feeding pump, typically a nurse will teach you how to use the pump before you leave the hospital. If you end up using a different brand of feeding pump than you had in the hospital, the supply company representative will teach you how to use the new pump. Okay, so now we're going to talk a little bit more about the feeding tube itself. Some GIs or pediatric surgeons insert a non-balloon feeding tube during the surgery, and after 8 weeks or so, change it out for a balloon button once the stoma site has healed. Then parents are trained on how to change a balloon button. The balloon button is inserted into the stomach, and then water, about 4 to 5 milliliters, is inserted through a port, and it's this balloon that holds the feeding tube in the child's stomach. It's about the size of a grape, and that's what keeps it in place. Parents then need to check the water once or twice a week by inserting the syringe and pulling back to see how much water is left in the balloon. If the balloon is not inflated enough, then the parents will add water and top it off. And then every 2 to 3 months, this balloon button is changed out, where the balloon is drained, and then you remove the feeding tube, insert a new feeding tube in its place, and refill the balloon on the new tube. Then you'll put a feeding extension on that new tube, insert a syringe into the extension, and pull back on the plunger to make sure stomach contents are filling the syringe. If so, you can be confident that the balloon was placed properly. And here's a clip showing that process. Although balloon buttons are the most commonly used feeding tube, we actually far prefer a non-balloon button, which is inserted by a pediatric GI or pediatric surgeon's office and typically lasts 6 months to a year. The reason we prefer a non-balloon button is because depending on a child's level of stomach acid and other factors, the balloon can fail or leak, at which point the feeding tube will fall out. And if this happens at night or while no one can see the tube, the stomach closes incredibly fast, in about 30 to 60 minutes. And without intervention, it can require another feeding tube surgery. Finn's balloon, our son, failed multiple times and his feeding tube fell out multiple times. We were able to catch those before another surgery was required, but we know other families who weren't so lucky. The stress of this happening caused us to have the non-balloon button installed in his pediatric surgeon's office, which is a non-sedated 5-minute procedure, and it has been a great choice for us. Again, this G-tube requires a visit to the doctor to change out, but it lasts 3 to 4 times as long as a balloon button and reduced our stress greatly. And again, as mentioned earlier, even if you use this non-balloon button, you'll still need a balloon button as a backup in case the non-balloon button becomes dislodged. In conclusion, we'll recap the big points from today. 1, make sure you have a refeeding plan from your GI doctor or registered dietitian for at least a week after surgery. 2, make sure you understand the post-operative wound care and make sure you know what signs to look for if there's an infection. 3, stabilize that feeding tube for 8 to 12 weeks or more so that the stomach heals well. Continue to rotate the feeding tube twice a day. 4, choose a medical supplier that you like and understand what supplies you're receiving and when. Make sure you understand how to use the feeding pump if needed. And a further thought is to decide whether you want to use a balloon or non-balloon button as the long-term choice for you and your family. To anyone who's watching, if you liked this video, please hit like and subscribe if you'd like to hear more on these topics. And please leave me a comment or drop me a line at our special lives. I'd love to hear from you. Thanks, everyone.